Okay, it's Dr. Buford. We're just getting started on the left shoulder. We're looking at from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. First thing we're going to look at is the biceps tendon on the right side of this blue cannula. You can see it's torn at its base, and we were planning on doing a tenodesis if we saw that. And since we see it, we're going to do what we plan to do, which is in just a second you'll see a spinal needle coming through. See, I'm going to change that angle just a little bit for us. Okay, I like that angle for starters. Take that. I'll need a grasper here. So if you keep looking at the tip of the needle, you'll see a grasper, a wire coming through it. There it is there. And I'm going to grab that. Hold the camera, please. No, press, no, just run the camera. Stay right there, real still. Okay, now we'll back the needle out. Outside your shoulder, we're going to load that super shuttle. So that's step one. We're going to go around that biceps one more time. We'll show you when we're done. Okay, so we've got the biceps released. And as we look down the front of the shoulder, this anatomy looks just fine. There's the subscap tendon here, middle glenohumeral ligament right here, anterior band of the inferior glenohumeral ligament there. And as we look at the joint, I don't see much arthritis. And so now we're going to look at the rotator cuff. We know there's at least some partial tearing. And as we look up at it, we can kind of see it in our face here. We'll take a spinal needle and we're going to pass a stitch across the area that's got this little undersurface fraying. So that means passing a stitch, one right about here. This will basically serve as a marker stitch for us because the rest of this cuff here looks pretty good. Hold the camera. Let me see. Okay, so we've taken off some bone here. You had a pretty good sized spur, and now this acromion at the top of the screen is pretty flat, so I'm happy with that. You can see the clavicle over here. This is the edge of the clavicle right here, and that's been smoothed out too. And so here's one of the marker stitches. I'm going to try and get them both together, those purple sutures. Here's the other one. So I'm going to grab this one and this one, just like, let go. Just like that. And now we have those sutures inside that posterior cannula. And we know that on the articular side, that's where the tendon was a little bit frayed. Now it's a little bit frayed on the bursal side here too, but for now, hold the camera here. I'm going to go ahead and tie that absorbable suture. Okay, so now we're having a look at what we've done, and we want to see if there's anything else we have to do. We've tied this kind of ripstop stitch for the rotator cuff right there. I'm happy that this didn't have a big tear on the bursal side. There's a little bit of fraying here, but nothing that needs a repair. We've tied the bicep sutures, so we did a soft tissue tenodesis right there. You had a very robust coracoacromial ligament and a big spur, and I think that's part of the reason why we just couldn't get you better with our typical non-surgical things. But now those are all removed as well, so you ought to do great going forward. So we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.